Good evening and welcome to CAN TV. You're watching Hotline 21. This is a live call-in show. If you would like to call in with a question, please call 312-738-1060. I'm Alice Merrifield. I'm Chief Clinical Operations Officer for Beacon Therapeutic. And tonight I have with me TeraKesha Wearring, also from Beacon Therapeutics 100,000 Homes campaign. So, welcome again. It's a live call-in show. You can call the number at the bottom of your screen at any time. So before we go to TeraKesha, I'm going to post some contact information for Beacon Therapeutic. You can see our web address. It's www.beacon-therapeutic.org. We have 4 locations. We have our administrative offices on 103rd Street. Our homeless outreach services, which is where our 100,000 Homes is based, is on Western Avenue. We have a junior and senior high school at Calumet Park. And we have our Longwood campus, which is our elementary school and our outpatient programs. Beacon has numerous programs. Beacon initially started as a therapeutic day school by a group of parents in Beverly who gathered together feeling that their children needed better education than what they were currently getting, and they started the agency. Since then, Beacon has grown to include a variety of services, including outpatient mental health services, intensive outpatient programs, shelter outreach services, and the Children's Insurance Program. And now we've branched into Early Head Start, which is an educational program for 0 to 3-year-olds. So tonight we're going to be talking about our Family 100,000 Homes campaign program. This is a new program to Beacon Therapeutic this year. And we have with us a therapist for the program, TeraKesha Wearring. And so, TeraKesha, tell me about something about yourselves and like how you got to Beacon and kind of a little bit about what your background is.
Well, I came to Chicago about 15 years ago doing public health work. Been working in Chicago communities for that length of time, violence prevention, asthma for children programs. And so I switched my career a couple of years ago, went into more mental health counseling and therapy. So I have a master's in clinical mental health counseling. Okay. And so the reason why I came to Beacon is because of the work that you all have done that in mental health services for children and for the homeless population and for families that are in and individuals that are living in the shelters. So your expertise in that area.
Okay. And I know you've been trying to develop the mental health sort of portion of things, but are you still finding that you get to use some of your public health background as well in this program?
Absolutely, I do. Because public health is just an array of just a lot of different health topics,
including mental health.
Including mental health.
Right.
So I think just it's more now focused in the mental health, working with Beacon, as opposed to just kind of doing everything in general. So just more mental health focused.
Okay. What do you like about being at Beacon so far and working on this program?
I think for me, working at Beacon, it's the commitment to the families and the children that we work with, seeing them housed, seeing children get services, and seeing them excel emotionally and in school and behaviorally, and so just that this has been good for me is the commitment and the loyalty of working with the children and families in the community.
Okay. So tell us something a little bit about the Family Homes program, or what was the 100,000 Homes program?
So the 100,000 Homes program is a program ultimately to house the most vulnerable families in Chicago. Part of that includes outreach and engaging to the families. So providing them with case management needs, providing them with counseling and therapy if they need that, referring them to psychiatric services that are at Beacon. But the ultimate goal is to find housing for them because they're chronically homeless. And so that's the ultimate goal with the program.
Okay. And I'm just going to put up a little slide here about how 100,000 Homes started. 100,000 Homes campaign started nationally by, I think we have a caller. Okay, sorry, I'll finish this and then we'll take the call. 100,000 Homes campaign started as a national program. Chicago joined a little while ago. The program is about identifying the most vulnerable homeless individuals, and is now expanding into including homeless families that are also vulnerable. So Beacon's program actually focuses on the family aspect of it, and there are other agencies that are also linked up in this program, including the AIDS Foundation of Chicago and Heartland Health Outreach, that are providing services for singles and other kinds of services within the program. Can you talk to us a little bit about like the staffing pattern for 100,000 Homes and some of the activities that you're doing?
So our staff is, it's a small staff for us, but we make things happen. So it's my supervisor, who is LaVey Smith, and then we have a case manager, who is Tanya Lindsay, and then myself, who is the therapist. So we get referrals from the Chicago the Corporation for Supportive Housing, that come to us, and then we do outreach and engagement with those families once they're identified. And so what that entails is just really making an initial phone call, finding out where their families are at that moment, or if they're still in shelter. Some of them may have gone living with a relative until they're able to find housing. And then we assess their needs, as far as with their case management needs, and to see if they're still interested or in need of housing. We called someone last week. They live with their grandmother, but they were getting a job and they wanted to find their own housing. So at that point, we just, say that we're still here if you need our services. If not, then we just, go on with the next family. So from that, once we outreach and engage, find out their needs, assess them, refer them, or offer services that we have at Beacon.
Okay. Let's talk a little bit. We have a call. Good evening, caller.
Yes, hi. We are totally impressed with what you are doing at Beacon. And as a community, we're wondering what type of resources could help you, or could we help find for you?
Thank you. Good question. I think at this point, Beacon receives a lot of donated goods. A lot of times we need things that people typically need when they're first moving into a home. So even things like cleaning supplies, and mops and the actual cleaners themselves, sheets and linens and mattresses and just sort of that basic kind of furniture and things that you need to set up a house. A lot of our families don't have any of those items. So donated items like that always help. We do get quite a bit of donated clothes and toys and things like that. So those are always helpful as well. And then actually, sometimes we can just use even somebody volunteering to bring a van and help move somebody would be a big help sometimes, because a lot of times our staff are either getting a van or they're trying to do something or trying to move people in themselves, and it can be quite challenging. So those are some of the things that people can do to support the program. And I'm going to put up a picture of one of our families. Oops. Sorry. There we go. So what's your role within the Family Homes program?
So my actual title is a therapist, but I actually do anything from case management to doing mental health assessments, to referring participants to the psychiatrist, getting them to their appointments, finding resources in the community for them, perhaps even sometimes driving them to those appointments, whether it's a doctor's appointment or whether it's an appointment with an interview for a housing opportunity. So it's a lot of different things that, that I do. I even do therapy and counseling with some of the participants if they need that. So a lot of different things.
Okay. Can we talk a little bit about the Family Vulnerability Index and what that's like and how that was developed? Initially, there was a singles vulnerability index that was used in the 100,000 Homes campaign that was evidence-based for single, homeless, and chronically homeless individuals to assess the risk. And the risk that they were looking at for the singles was actually the risk of their possibly dying on the street. And so since then, Chicago's been one of the cities that has had sort of a team of people working together to develop the Family vulnerability index, and I think you kind of came in on the end of that process when we were actually like sort of trying it out and seeing how it worked and whether it really told. So can you talk a little bit about that?
Well, Alice, from what I can see is that when I first came on is at the end of where, the vulnerability pilot, I believe Beacon was the pilot for the Family Vulnerability Index. And when I came on, the index is a list of surveys that addresses the risk of those who are chronically homeless. And so based on that questionnaire, each head of the household is given a score. And the scores are based on their history of maybe being in the foster care system, having trauma, having a mental health diagnosis, having some type of physical illness. And so based on those risks, the higher their score, the more vulnerable they are.
Right.
For being at risk for being chronically homeless and for a number of other things. So our idea is to take that vulnerability index, score it with the help of the Corporation Supportive Housing, score that, and then take those families and find housing and other needs that they may have based on their scores. So again, the higher the score, the more vulnerable. And those are the families that we really want to work with.
And for the families, they're really looking at the vulnerability for being separated from each other. So the risks of the children either being sent to foster care or being separated from their parents for whatever reason, whether it's child welfare or just circumstances of being homeless. And at this point, the system is also moving towards the centralized referral system, which is where people will actually be able to go online and fill out the survey, and then they'll automatically get scored, and there'll just be a list. That's a web-based list, and that the Corporation for Supportive Housing has been working on and setting up. So can you talk about, do you have any idea like how that process is going to work once it's all a little bit more automated?
Well, the little bit I know about that right now is that we currently, the Corporation of Supportive Housing has an online tool called HOST, which means the Housing Option Survey Tool. And so pretty much anyone can go on and complete that online tool.
Homeless families
families, individuals, families. As a therapist with Beacon, I go on there where I'm working with a participant and help them complete that. And based again on their vulnerability or their need, their information is sent on to other organizations like Feather Fist or HOW, which is Housing Opportunities for Women, and they help them to get placed in housing. However, Corporation of Supportive Housing, they're the ones that take care of that online survey tool. They handle that and that's how we get our referrals.
Right. So they are actually providing you with a list of referrals.
With the list, yes. And so eventually all of those names that are on HOST are going to be moved to the centralized system eventually. And other organizations who have the people that are homeless or head of the household, they can put their name in there. And just as you said, that'll be like the main list of organizations who can pull from that list of people who need housing. So it kind of keeps it in a mainstream where everyone's not all over the place. Everybody can get served the same, and it can be based on how vulnerable they are.
And we'll put another picture up. The family moving into a house, very appropriate for this program.
Absolutely.
So once they have a family vulnerability index, is there opportunities if their circumstances change? They can go back into the centralized, once it's up and running, they will be able to go back up into the centralized referral system and actually like adjust it so that it's consistently updated as long as they keep their information in the system updated, which I think is very important, since the other thing I think I wanted to add to what you had to say was that the first thing that HOST does is decide or determine whether they have the right circumstances to qualify for permanent supportive housing, because that's a tool that just identifies permanent supportive housing. And so once they've been determined that they meet the income and some of the other requirements, then it goes on to do the vulnerability index and things like that. So talk a little bit about like some of the data that you're keeping and how you're sort of keeping track of like where you are with the grant, but also how you're doing in terms of getting participants housed or getting them the services and getting them linked up and stable.
Well, anytime we have contact with a participant, whether it's a phone call, it's a meeting, or if we're advocating for them with another organization, we are actually keeping notes and keeping track of that. And then we also have our quality assurance team that helps us keep track of our objectives. So, and our objectives can include anything from being housed to increasing your income to having a mental health assessment completed and being referred to the psychiatrist. So those are the objectives that we're keeping up with and that we keep track of.
Okay, thank you. What would you say are some of the more significant challenges in the program, and what kinds of barriers do the families face? And do you guys face in trying to get the services to the families?
Well, because most of the participants are looking for housing, which is kind of their ultimate goal, we one of the challenges because of the housing market is the opportunities for housing have been low. So finding adequate housing for our families and just finding some of our families are large families. So if we have an opportunity for a 1 or 2 bedroom, when we have families with 4 or 5 children, it's just not a big enough place because we're not serving individuals, we're serving families. And most of our families, are larger families. And so looking for the housing, some of the challenges have also been believe it or not, sometimes housing is not that important for them. More importantly, they want to stay in the shelter because they can stay in the shelter for a year in some different shelters. So they feel like, well, I can stay here, save some money for a year, and I don't have to go anywhere. So then those families, we kind of, help them with case management needs if they're looking for a job, those kinds of things until, we're no longer working with them. Some of the other challenges, again, have been kind of families, how they're transient. They're in this shelter, but then they've got to go in a month. So then they go to the next shelter, and then we can't find them, or they don't update their phone numbers or their contact information. So then we're left trying to find them and or having to just find more participants that we can work with.
Okay. And what would you say are some of the rewards of the program?
Well, of course, when someone's housed,
Yeah.
when they found housing, it's great. We've had a young lady who recently just got housed, and it's great when you see a young mother of 3 move into her own apartment that she's never had, and she's able to do it. She's able to take care of her children, take care of an apartment, still keep up with me and me still keep up with her, make weekly phone calls and visits. And so those are some of the rewards. One of the other rewards have been because people who are homeless, tend to struggle with a lot of mental health issues, and they've been looking for a way to get serviced for those needs. So sometimes just to help a person who's been depressed for 10 years, and they haven't been able to receive treatment, to be able to make that referral to the psychiatrist and help them take care of their mental health concerns. So that's been very rewarding.
So the participants who come into 100,000 homes at Beacon can then also access the psychiatric services. Are there other services that they've been able to access?
Absolutely. The FACT program that we have and the PATH program, some of our participants we've actually referred to those programs because they just meet the criteria for those different programs.
Can you tell us a little bit about what those criteria are?
So for the FACT program, they have to be a single mom with children, and they have to be under the age, if I'm not mistaken, 25. homeless at some point. And so then working with their therapists and case managers in that program. And then the PATH program, you have to have a chronic mental illness like schizophrenia or bipolar or major depression.
Right.
And so a lot of our homeless population fit that criteria. And then we've also, some of the services that we also refer, if we have a mother who has children under the age of 3, we refer them to our early Head Start program. It's for developmental screening and different things like that. And of course, little IOP and big IOP. We do it all.
And little IOP is the program for 3 to 6 year olds who have a mental health or behavioral condition. And that's an on-site intensive outpatient program that runs from 9 until 2:30 every single day. We bring the kids in, whether they're from shelters or they're in housing, and provide programming and treatment for them. And Big IOP is the older version of Little IOP.
So we take advantage of all the Beacon services that we can use for the Family Homes program.
And then we also have a psychologist on staff who's also available for consultation, to do psychological assessments if it's needed, and and other things. Can you talk a little bit about services that you've been able to link people up with outside of Beacon?
So one of our best supporters has been housing opportunities for women, which their program is you have to be homeless, chronically homeless, as identified by HUD, housing. What is HUD? What's that? I can't remember that.
Housing Urban Development.
Development, yeah. So whatever they do, and so we actually. They have to be chronically homeless and they have to have a mental health diagnosis. So we help them complete the application for that. We make sure that they get set up with an interview with Hal, and we take them to the interview, and then kind of walk them through the process if they need other documentation for the housing application. We help them get that, and then we help them go through the process of being housed with Hal. So that's been one of the organizations that we've been working closely with, and some of the things that we've been doing.
Okay. I'm also going to put up our contact information again while we continue to talk a little bit about some of the other. Now, are you also able to link people up with health services? Have you, a lot of times it seems like the homeless families have difficulty accessing health care. Can you talk about, have you developed partnerships with different healthcare providers that you've been able to hook people up with?
Well, what we've actually done with some of the work that I've actually done is that some of them, because they have children, they access the Medicaid system already. And so we just help them make sure that they're optimally using that service. So helping them find a clinic that's close to them, that has some pediatric services, that have women's health services so women can get their care. And if it's a father involved, making sure that he's linked up, with a health care provider in the community. So the young lady who just was housed, she moved from all the way from the south side all the way to the north side.
Wow.
So part of our plan and our goals was for her to help her identify providers in her neighborhood so that she can be linked with someone in that area.
Okay. We're getting low on time, so I'm wondering if you have a couple of words quickly to wrap up, and then I'm going to show some information about our annual supper coming up. And
okay. All right, so just the Family Homes program, it's been great, working at Beacon. I just feel like an organization that's been in the community for 44 years. It was a place that I wanted to be at because it just shows their commitment in the community. And our program is we're actually helping the most vulnerable families in Chicago become housed and to meet the needs that they have. And so it's been great working here. Thank you.
Okay, thank you. Thank you for coming on the show, TeraKesha. Let me just put up, this is information on our 20th annual holiday dinner. This year it will be Friday, November 30th from 6:30 to 10:30 at our Longwood campus, which is at 107th and Longwood in the Beverly area. For tickets or information, you can contact Peggy Work at 773-298-6441. And finally, I'd like to put up our new motto, creating new endings to disadvantaged beginnings. So thank you for coming on the show.
Thank you.
Good night, everybody.